Hi and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. Today I'm going to be looking at a question that gets asked regularly in the clinical sessions that we do when we're in therapy with people who dissociate. And that is, when could my dissociation have started? Which is a very difficult question because we often think about dissociation occurring very early in a person's development, so it's usually precognitive, so they might not have clear memories of when dissociation started, or dissociative amnesia might get in the way and prevent that sort of question from being answered. We have to try and think about what it is the likely formation of dissociation, and that dissociation can begin over a period of time in different levels. So some forms of dissociation might not immediately become something like dissociative identity disorder, but that could emerge later on in childhood. It depends on the development of the situation the child is in and the nature of the brain's developmental processes. One of the ways that I wanted to look at this today was thinking about attachment systems. There's been a lot of research over the last few decades into attachment, largely stemming from Bowlby and Ainsworth. So attachment research is very well understood, and we have lots of different ways of understanding how attachment works. What Paul Dell and John O'Neill have done in their book in 2009 is try and set out a series of theories as to how dissociation might take place by bringing together some of the best minds in this field and looking at this research question. The concept that is being looked at then is whether or not a form of attachment, such as disorganised attachment, can actually lead to dissociative processes in of itself. The main chapter that I'm going to look at in Dell and O'Neill's book today is by Giovanni Liotti. So what he was trying to look at was a proposal that unresolved trauma in the parent or caregiver can lead to the forms of attachment, disorganisation that can then end in dissociative processes. The key role then is the type of attachment that is being formed between the parent or the caregiver and the infant as a result of whatever the parent or caregiver is carrying within themselves. What Liotti went through is some of the research in this area. So Main and Hesse in 1990, they demonstrated that caregiver behaviour, if containing this kind of unresolved trauma, can be frightening to an infant. So the type of behaviour that is being formed by the parent in the environment of the child, so not necessarily directly to the child, for example through violence or threat, but actually could be indirectly through just a series of confusing behaviours or unpredictable behaviours that the infant is picking up and is part of, and is becoming fearful or distressed by witnessing. The type of behaviours that the infant is seeing then induce fear or distress. And this is very confusing to the infant because our attachment system is designed that when an infant becomes fearful or distressed, it approaches its attachment figure. So it approaches the parent or caregiver for reassurance and attention and a sense of safety. But if the parent or the caregiver is the person that is inducing that fear in the first place, a conflict begins to emerge in that infant, whereby the person that they are being scared of is also the person they need to approach in order to reduce their level of fear. And that's the paradox that Main and Hesse formulated within their research that Giovanni Liotti is describing within this chapter, that there is something called fright without solution. And what that means is that there is no way out for the infant, because the only way that the infant can actually reduce its own fear and distress is by approaching the parent or the caregiver, whose behaviour might be so unpredictable or fearful that it does not provide any reassurance. It provides no solution to what the infant is experiencing. Remember, we're talking about infants, we're not talking about highly cognitive or verbal children or late children, teenagers. We're talking about infants that lack the ability to be able to negotiate their own problems. We see then that the caregiver becomes the source and the solution to the emotions being triggered and activated within the infant. We don't generally have many systems within which to deal with threat in our environment. We don't really need that many. We basically have two that are built in. We have our defense system, which in early sort of evolution or development of the brain is the fight, flight, freeze responses. These are our inbuilt defense responses right from the get-go. They are designed to manage the immediate threat. The second system that we have is the attachment system. So if we're not able to manage the threat, we use our attachments, we use our social bonds, we use our connections to other people within which to then approach and get help to resolve the fear or resolve the threat that we're seeing. So if something is scaring us, we can either deal with it ourselves, or if not, we go and find help. For an infant, that attachment system, it relies on the immediate people. They can't leave the property, the building, and go find help from extended family or friends and neighbours. They're infants, they can only get help from the person who is immediately there. So we see the conflict emerge, that the infant is frightened, it cannot defend itself using fight, flight, freeze responses particularly well, so it approaches the attachment system, who is the person who is causing them the fear in the first place. There is our conflict, there is the paradox for the infant. And what Liotti did is he looked at different strands of research that have been done on sort of daily observations of interactions using things like the adult attachment interviews and various sort of like observed clinical and clinical trials looking at how parent and caregiver behaviour can affect infant development. And what was seen with this is a specific piece of research that Liotti refers to, which is Lyons-Ruth Jacobvitz in 1999, whereby the daily proximity of the infant to unresolved difficult behaviours in parents are leading to a number of attachment styles in the infant that are dissociative in nature and origin. So over time, the interactions between the parent caregivers and the infant are leading to states which can be called dissociative in very young infants, and these were seen in clinical trials way back in the 1990s. What they weren't observing was direct threat behaviour toward the infant. Ethically, obviously, that would have been very problematic, but what they were seeing is lots and lots of behaviours that were clearly resulting in disorganised attachment states within the infant from low-key, indirect behaviours resulting from the behaviours of the parents and the caregivers, often as a result then of unresolved losses, grief, traumas in their past, which make them unresponsive in a nurturing capacity towards that infant. So fear and confusion is being set up within the infant through indirect behaviours which are leading to a conflict, a paradox of how to manage that behaviour, which then leads to a dissociative state as like an emergency fallback towards how that child, how that infant can protect its own psychological state from the behaviours that it's experiencing. All of these things are very simple when you actually stop and think about it. That a parent that has unresolved trauma lacks the capacity or the ability to completely and utterly be present with that infant properly in an organised attachment system, because often the parent caregiver lacks their own organised attachment system. The infant becomes disorganised, the infant becomes confused, becomes fearful, it doesn't have the adequate defence systems and attachment systems to manage that fear and distress, so the infant becomes dissociative in order to cope on an internal psychological process. And we see that then as the potential emergence of dissociation without there actually being direct threat or assault or abuse or any of those kind of things towards the infant. These can be very loving, can be very engaged parents that simply lack the ability to be consistent over a long period of time and confuse and distress their infants, mainly without really intending to. So infants can then develop dissociation through a fairly benign environment that actually on a low-key level over a long period of time, months and years, causes dissociative states through fear and distress and confusion. I hope that helps answer some of the questions. It's great research. I'd encourage anybody to sort of go back. I'll put the research into the description for the video so people can look it up, and if they would like to sort of read more on this, that would be absolutely wonderful. It doesn't answer all our questions. It doesn't really answer exactly why that dissociative process that might emerge into either OSDD or DID or dissociative amnesia or depersonalization. Those are very different directions for research to go into, and this is still an emerging field. But hopefully it's given some sense as to where trauma might play a role in the development of dissociation in an infant or a child, or then becoming an adult who doesn't really believe that they've undergone significant trauma in their lives, that dissociation can occur without that being there if attachment systems are playing out in the way that I've described. So I hope this has been helpful. Please like and subscribe for future content, and leave any comments in the section below the video, and I'll do my best to read as many as possible and respond where I can. Thank you very much, and before we do the next one, please do take great care.